Hello, everyone. Welcome to our presentation on talking with your child about COVID-19. My name is Ashton Parker, and I am a registered psychologist with Edmonton Catholic Schools. Together with my colleagues in the psychology department, we've put together a brief presentation for parents. Our hope is that after watching the presentation, you'll feel better equipped to speak with your kids about COVID-19. As you're well aware, COVID-19 has led to many changes in the daily routines and lives of children. Therefore, it's important that we talk to them to help kids understand the reason for the changes and what to expect. These conversations can be difficult to have, but are important, so we've put together some information to help. These are some common parent questions that we aim to answer during this presentation. So first, should I even talk to my child about COVID-19? Second, how can I start talking to my child about COVID-19? Third, how much information should I share about the virus? So there's lots of information out there, and knowing what to share with your child and what not to share can be challenging. How can I help my child if they're feeling worried? So what are some things that you can do or approaches that you can take to help them feel supported and secure? The first thing that I would like to address is that it's normal and expected for children to have different reactions depending on their age and developmental level. So for aged children, you might notice regressive behaviors, that they're talking less, that they're appearing more anxious. For elementary school age children, you might be noticing that they're finding it hard to focus, that they're more irritable or more easily set off, that they are engaging in clinginess, so perhaps following you around, having difficulty separating or playing on their own, that they're becoming more aggressive, that they're complaining more of physical complaints, so like stomach aches and headaches, and that they're experiencing more nightmares. For middle and high school age children, you might notice changes in eating and sleeping patterns, agitation, an increase in conflict with others, physical complaints, and that they're engaging in riskier behaviors, so maybe pushing boundaries more, and poor concentration as well. A child's response to the current stressor of COVID-19 can also be impacted by a number of risk factors, such as the level of parental support, dislocation from home or their community, what their exposure has been to the actual event, and that could include immediate exposure, personal injury or loss of a loved one during COVID-19. So if they've had a really personal experience, it's going to be harder for them, understandably, to cope and manage that stressor, and whether or not they've had a previous traumatic experience or if they've suffered from any kind of mental illness. So for example, if your child experienced a traumatic event or suffered from a mental illness, such as anxiety or depression, prior to COVID-19, they may have a more difficult time adjusting to and coping with the current COVID-19 pandemic. There are some general principles to keep in mind when talking to children about COVID-19. So first, it's important to remain calm and reassuring. Remember that kids react both to what you say and how you say it, and they will pick up on cues from the conversations that you have with them, but also with the conversations that you have with others. Second, you want to make yourself available to talk. So you want to be sure that kids know that they can come to you when they have questions. Third, avoid language that might blame others and lead to stigma. So it's important to remember that viruses can make anyone sick, regardless of a person's race or ethnicity. and you want to avoid making assumptions about who might have COVID-19. Next, you want to give kids the space to share their fears. So it's natural for kids to worry, and you want to try to avoid saying things like, don't be silly, or just don't worry about it, and instead let them know that kids don't seem to get as sick as adults, and let them know that they can always come to you for answers or to talk about what scares them. And lastly, you want to make sure that kids know that it's normal to feel stressed and worried at times, because everyone does, and helping them to recognize their own feelings, and also helping them to know that stressful times pass and life gets back to normal can really help them to build some resilience. To introduce the conversation of COVID-19, you want to find out what your child already knows about the virus and how they're feeling. And this will give you a good starting place and help you correct any misinformation that they have. You can ask questions like, a lot of people are talking about a new virus called the coronavirus or COVID-19. Have you heard about it? What have you heard about it from people at school or friends online? How are you feeling about what you know? For younger children, you could say, have you heard grown-ups talking about a new sickness that's going around? If you don't know the answer to something that they ask, be honest and tell your child that you can look it up together. And you want to access websites like the CDC and Alberta Health Services for accurate information. Consider reducing the amount of screen time and media exposure that's focused on COVID-19, because too much information on one topic can lead to anxiety for anyone. After asking them what they already know, you want to share information with them at an age-appropriate level. To do that, provide information that is honest and accurate. Give them information that is truthful and appropriate for their age. Talk to them about how some of the stories about COVID-19 on the internet and social media might be based on rumors and inaccurate information. Keep information simple and remind them that health and school officials are working hard to keep everyone safe and healthy. Here are some examples of information that you might share with them. So COVID-19 is the short name for coronavirus disease 2019. It's a new virus. Doctors and scientists are still learning about it. Recently, this virus has made a lot of people sick. Scientists and doctors think that most people will be okay, especially kids, but some people could get quite sick. Doctors and health experts are working hard to help people stay healthy. And lastly, we're trying to do what we can to stop others from getting sick. Number 3 is to share with kids what they can do to stay healthy and keep their families healthy. This will give them a sense of control and responsibility. Engage them in a child-friendly way. For example, the whole family could become germ busters. So you want to follow the CDC and Alberta Health Services recommendations, such as reminding kids to stay away from people who are coughing or sneezing or sick, coughing or sneezing into a tissue or your elbow, and if you sneeze or cough into a tissue, to throw it away in the trash, to keep your hands out of your mouth, nose, and eyes, and this will help to keep germs out of your body, to wash your hands with soap and water for at least 20 seconds, especially after blowing their nose, coughing, sneezing, going to the bathroom, and before eating or preparing food. You can follow a series of steps with kids. So first, wet your hands, then lather or make bubbles, then scrub or rub together your hands, rinse and dry, and you can sing a song like the Happy Birthday song twice. If you don't have soap and water, teach kids to use hand sanitizer. Hand sanitizer should contain at least 60% alcohol, But of course, you want to make sure to supervise young kids when they use hand sanitizer to make sure that they don't swallow any. You want to keep things clean, and older kids can help adults at home to clean the things that we touch the most, like doorknobs, light switches, and remote controls. You can find more information about cleaning and disinfecting on the CDC's website. And I think lastly, just to make sure that kids know, if you feel sick, you need to stay home. Just like you don't want to get other people's germs in your body, other people don't want to get your germs either. And lastly, reassure children that many people are working hard to keep them safe. You also want to model calmness and, like we said before, answer questions that they might have with age appropriate facts. Helping kids to understand that everyone is working hard to keep them safe can be reassuring and help them to feel calm. Let them know that you're available anytime they have worries or questions and be there for them. Thank you very much for following along with the presentation. I hope that you found it helpful and informative and feel at least a little bit more confident in having conversations about COVID-19 with your kids. We have provided a list of resources where you can find more information about COVID-19 and sharing information about COVID-19 with your kids. I encourage you to explore these resources. The psychology department has also created a PDF handout for you that reviews the information discussed in this webinar and provides direct links to resources. Take care and thank you for your time. And please keep your eyes out for more presentations and resources from our team.